My name is Robert Biederman. I'm a cardiologist and the director of the cardiac MRI program at Allegheny General. Today, my invited lecture was on serendipity. Does chance truly favor the prepared mind? The lecture is the first one that we've heard all day today and the last 2 or 3 days at this nice meeting, in which presented no data, no randomized clinical trial, no science, just recollection of prior events about serendipity. Serendipity has been described by Horace Walpole the first time it appeared in the English language in 1754, and he described it when he wrote The Princess of Serendip, and he described his wonderful stories off of Madagascar, and he noted that wonderful and good took place in events of accidental discoveries. And so the notion was that good things could come out of things by pure accident, and he reckoned that those were some of the things that took place with him and his experiences, and coined the term serendipity. It took 200 more years until the 1950s or so for that to find its way into the Webster's language in the dictionary. But this notion is a concept that I think we all are aware of and think about on a time to time, especially if we're researchers, and know that in medicine and business and science that things do happen quite by chance. But the real undertone of my discussion today was, in fact, does serendipity truly play a role anymore in the medical community, in the research, in the scientific way that we do examine substances and pharmaceutical drugs and find things? Did we put a man on the moon by pure accident? No, we didn't. I mean, years and years worth of work. The light bulb that we ascribe to as this eureka moment that Edison had, in fact, wasn't a eureka moment. It wasn't a bolt of energy. It was years and years of systematic, hard, arduous effort, testing compound after compound after compound, till we finally found one that worked. So, but yet serendipity seems to play a major role in a lot of what we do, and especially at this meeting, thinking about cardiac-wise. And I'll just relay a quick story of one of 4 or 5 that I relayed. And it has to do with Mason Sones. In 1958, he serendipitously discovered cardiac catheterization. He didn't set up a series of examinations and tests and see if this works and what doesn't work. He was under the working notion that if you put a catheter into someone's coronary, that patient would die. And that had been passed on for generations in studies with dogs and with humans. And so in order to find how the coronary bed looked, you would put a catheter up into the aorta above the coronary tree and then inject retrograde, and the coronaries would then hazily define themselves. So Mason Sones is kind of a gregarious kind of guy. He's a hard-working guy. He doesn't take anything off of anybody. And in those days, the cath labs were set up very differently, and so the technologist and the guy who pushed the button for the injector was on one side. Mason Sones is in this dark, deep pit, and he's looking at the image intensifier, making sure the image is exactly right. Well, at the exact moment that the catheter was being injected, the catheter deep-throated into the right coronary artery, and before he could yell, Mason Sones could yell to the technologist, withdraw, withdraw. Catheter stayed in the right coronary, and contrast illuminated the entire right coronary artery. That image is now in the halls of Cleveland Clinic, this beautiful outline of the right coronary artery. It's an exquisite image, and he realized, aha, I've discovered something. But wait a second, the patient is going to die, right? He goes over, he takes his scalpel, and he's going to open the chest and do open cardiac massage. The patient's just looking at him. What are you doing? I'm perfectly fine here. And he says, oh my gosh, we've just discovered something. And so that moment changed forever all of cardiology, cardiac surgery, and what we are and what we do today. We're all cardiologists really because of that momentous, serendipitous moment. There's a corollary to that story. He's walking down the hall, and he's always thinking about things, always in the process. His brain is always in motion. And he walks in, and there's a secretary, and he says, ma'am, we've changed the world today. She's busy typing on another manuscript. She doesn't even look up. She goes, Mason, so what else is new? As it is, and that's a prime example of serendipity. So then the real question is, can we do this today? And are we in a process where serendipity plays a role? And the point that I'm sort of undertoning here, if that's a correct way of phrasing it, is that today's rigorous grantsmanship and efforts to try to get products approved, to try to get pharmacological drugs approved. You take a battery of 20, 30,000 candidate genes or candidate proteins, candidate substance, and test them out one at a time. And maybe then you get 20 or 30 that look like they're decent. And then maybe you do a little bit of testing here, and then you do phase 1, phase 2, phase 3, phase 4 trials. You spend millions of dollars and decades of work. And I think that we are being admonished for having serendipitous thoughts. And so the notion that serendipity plays a role now today is truly being questioned. It's being questioned in some places in Europe are trying to revive the notion that maybe we should do high risk, high reward type approaches. That's not certainly supported at the NIH, no matter how much they say. So I think serendipity is a concept. It's a neat thing to think about. And it changes the game in many ways if you have those kind of moments, and they seem to come to the same person over and over again. So I'll end by saying that not only does chance favor the prepared mind, as Louis Pasteur said, Horace Fleury, when he got his Nobel Prize award, said, not only does chance favor the prepared mind, that if the proverbial bolt of lightning were to happen, unless it finds a mind that's thoroughly prepared to receive it, it will ignite nothing. Thanks.